Hello everybody. Today we are going to do a short presentation regarding sex reassignment surgeries.
Some of you might be wondering, what is the meaning of the sex reassignment surgery? In layman's terms, from the name itself, it's the transitioning of the patient to their self-assigned gender. In the modern world, there are many terms that people use to identify their own gender that can be used to describe this. The surgery itself is used to transition or help them feel more comfortable in their own body. The main parts of the body that undergo this surgery are the genitals, the chest, and lastly the face, since those are the main areas that affect a person's view of themselves and their own body. So by changing those things, it allows the patient to feel more comfortable and more safe in their own body.
There are many types of sex reassignment surgery. However, the most common ones are facial reconstructive surgery, top surgery, and bottom surgery. To begin, let's talk about the first type of sex reassignment surgery called facial reconstructive surgery. Facial reconstructive surgery is done in order to alter a person's appearance and make them either look more masculine or feminine. People going through this process can undergo single or multiple stage procedures. Furthermore, we will have a brief discussion on the two categories of facial reconstructive surgery. These are facial feminization surgeries and facial masculinization surgeries. The first category we will talk about is facial feminization surgery. Ideally done to individuals transitioning from male to female, this procedure is done in order to make a person's face appear more feminine. Most of these procedures are commonly done to modify the appearance of a person's hairline, jaw, nose, forehead, and neck. Furthermore, the specific surgeries that can be performed include hairline lowering, cheek augmentation, lip augmentation, jaw reduction, chin reduction, rhinoplasty, forehead contouring, and tracheal shaving. The second category of facial reconstructive surgery is facial masculinization surgery. Ideally done to individuals transitioning from female to male, this procedure is done in order to make a person's face appear more masculine. Similar to FRS, these procedures are commonly done to modify the appearance of a person's hairline, jaw, nose, forehead, and neck. The common procedures involved in FMS are hair transplantation, jaw contouring, cheek augmentation, chin recontouring, forehead augmentation, rhinoplasty, and thyroid cartilage enhancement. Moving on, the second type of sex reassignment surgery is top surgery, or more specifically called chest surgery. This type of sex reassignment surgery is done in order to decrease or increase breast size for a more masculine or feminine appearance, respectively. Hence, there are two categories for transitioning chest surgery. These are the feminizing breast surgeries and the masculinizing chest surgeries. The first category of chest surgery is called feminizing chest surgery or breast mammoplasty. Ideally done to individuals transitioning from male to female, this procedure is done in order to increase, enhance, or change the shape of a person's breasts. These procedures can involve the placement of breast implants, the use of tissue expanders, or the transferring of fat from other body parts to the chest, also called autologous breast augmentation. The second category of chest surgery is called masculinizing chest surgery or subcutaneous mastectomy. Ideally done to individuals transitioning from female to male, this procedure is done in order to remove breast tissue while preserving the nipples and the areolas. This procedure involves the surgeon making an incision on the breast and removing the breast tissue. Apart from transitioning, mastectomy in general is also used in order to treat or prevent breast cancer. The last type of sex reassignment surgery is bottom surgery, or more specifically called genital surgery. This type of sex reassignment surgery is done in order to alter, transform, or reconstruct the genitals of a person. There are two categories of bottom surgery. These are the transfeminine bottom surgeries and the transmasculine bottom surgeries. The first category of bottom surgery is trans feminine bottom surgery. Ideally done to individuals transitioning from male to female, this procedure is done in order to transform the male genitalia into female genitalia. The most common procedures trans women undergo involves the surgical removal of the testicles through orchiectomy and can be followed by the surgical reconstruction of the female genitalia through vaginoplasty. The second category of bottom surgery is transmasculine bottom surgery. Ideally done to individuals transitioning from female to male, this procedure is done in order to transform or reconstruct the female genitalia into male genitalia. The most common procedures trans men undergo involve the removal of the vaginal cavity and the reconstruction of the penis through a surgery called phalloplasty. The removal of the uterus and the cervix is done through hysterectomy. The removal of the fallopian tubes and ovaries is done through salpingo-oophorectomy. The removal of the vaginal canal and opening is done through vaginectomy, and the creation of a penis is done through metoidoplasty.
How does male to female surgery work and what are the risks? For those who want to undergo the male to female sex reassignment surgery, they could undergo a surgical procedure that enhances the breast and feminizes the chest. The breast augmentation procedure is used to implant the desired chest. For the type of implant that will be used for the procedure, they will typically choose between saline implants filled with salt water or silicone implants filled with silicone gel. The possible complications with this type of surgery are bleeding, infection, poor healing of incision, hematoma, loss of nipple sensation, and loss of nipple and areola. For genital surgery, penile inversion vaginoplasty with a neurovascular uroclitoris is also an option. With a procedure called orchiectomy, where the testicles will be removed, the skin of the scrotum will be used to make the lips of the vaginal opening or labia, while the erectile tissue of the penis will be used as the neuroclitoris while ensuring that the urethra will be preserved and still be functional. The most common complications of this surgery are granulation tissue, intravaginal scarring, and prolonged pain.
How does female to male surgery work? What are the risks? Testosterone replacement therapy is required before undergoing gender affirming surgery. Female to male surgery alteration can be done through the following procedures: mastectomy, phalloplasty, and hysterectomy or vaginectomy. Transgenders opt to take facial reconstructive surgery, chest or top surgery, or genital or bottom surgery. Changes in facial surgery include injections for cheekbones, shaving down of jawbone to enhance their jaw features, rhinoplasty, etc. Subcutaneous mastectomy, a procedure done to remove breast tissue, is usually the most common surgery requested by transgender men. Hysterectomy, on the other hand, has two types: partial hysterectomy, wherein only the uterus is removed, and total hysterectomy, where both the uterus and cervix are removed. Another method is metodioplasty, which involves the changing of clitoris into a penis. Along the process, the surgeon removes the vagina, aka vaginectomy. The use of graft skin to form a neopenis is called phalloplasty. Complications of the said procedures include urethral fistula, urethral stricture, skin graft failure, and scarring.